Hello. Hello, hello. My name is Kelly McCutcheon Adams. I'm a senior director at the Institute for Healthcare Improvement, and it's really a pleasure and a privilege to get to be here with you today. I wish I could be there with you in person, but this week is spring break in our school district, and I am traveling with my family. I'm delighted to get to share some gratitude with you and also some thoughts that have been coming up in my own work related to teaching improvement science and leading improvement work. And really grateful for all the work that you are doing, which I'll talk about more in just a second. I wanted to start by sharing this greeting card by one of my favorite card designers, Curly Girl Design. It says, "Growth feels a lot like failure at first. Anything becoming something must first fail at being what it's always been." And then in the smaller letters, it says, "Every becoming requires some unbecoming." As I mentioned, my name is Kelly McCutcheon Adams. I'm in Essex Junction, Vermont. I'm a telecommuter. I've been a telecommuter with IHI for 20 years now. If you're lucky, you'll get to meet my 150-pound dog, Magnus. If we're not lucky, he'll knock the screen over. May also get to see our milkman pull up because, yes, it's Friday, and that's the day the milkman comes. I teach the Breakthrough Series College at IHI, which is our professional development program regarding how to run effective Breakthrough Series collaboratives. And I've had the pleasure of working in maternal health over the last, gosh, I guess it's been 5 years now. So glad to be with you. A few weeks ago, my family and I went to a local brew pub, and they were having a pizza night, and there was a basket on the counter with free stickers. I'm a real sucker for a free sticker. And this is what the sticker said: "Real change is incremental and ordinary. The world can be made a better place through quality, kindness, and action." And I just want to pause on that and say thank you for the work that each of you is doing in prenatal, perinatal, postnatal, neonatal, wherever, whatever part of the puzzle you have your arms around. Please know, as the sticker says, real change is incremental and ordinary. It can feel like, how can this little test that I'm running at the front line the next time we have a birthing person in labor, how can this be the thing that's going to make real change? So thank you for your kindness, for your action, for bringing quality to everything that you do. I'm very grateful. If I had only one slide that I could share whenever talking about improvement work, it would be this one. I borrowed this from colleagues in Denmark, where the Lego Corporation is headquartered. And I think this really gets at the heart of what we are up against, which is that this is a particular moment in time in healthcare. A lot of burnout, a lot of crisis, a lot of attrition, a lot of staffing challenges 4 years into a global pandemic. And people understandably have their heads down, and sometimes they have their heads down and they're pulling carts with square wheels. And improvement work is about stopping long enough to get the round wheels on. And that's hard. It's hard to convince people that it's really worth the pause. And so for all the work that you're doing, where you're just trying to get people to pause long enough to put those round wheels on, just remember they may not have a good perspective on why it's worthwhile in that moment. I want to say a particular note of thanks to everyone who has been leading work around cardiac conditions. I had the pleasure of being involved at IHI in the creation of 8 change packages that correspond to the 8 AIM core bundles. I always find that a tongue twister. And it was my own ignorance that when someone said one of the ones we were going to do was cardiac conditions, I was like, what? That's not familiar. And the first thing I was told was, don't worry, there's great people in Georgia who are taking the lead on this. And so I just want to say, on behalf of the nation, thank you for taking that lead around the work on cardiac conditions. I also want to say a special thanks to the folks involved in the neonatal work around optimizing newborn nutrition. That work has had really high engagement, and excited to hear about the results of that. So as I said, I just wanted to share a couple things that have been top of mind for me lately. One is about how much of leading improvement work is about helping teams, again, getting the round wheels on, but getting momentum. And if teams are stuck in analysis paralysis, by definition, they will not have any successes. And I just love this little cartoon over here, that it is only through many attempts that we could ever possibly hope to get success. So much of what we do when we're teaching, guiding, coaching, leading improvement teams is around getting people into motion. Another thing that has been top of mind lately is the word sustainability, which I think has a little bit of a buzzword quality right now. And so if that word has been top of mind for you as well, I encourage you just to pause for a minute and think, if you decided to run a marathon, what must happen before you do that? Like, could you get up the next day and run a marathon, or is there something that would have to happen beforehand? For me, I'm not sure any amount of preparation would help, but I would certainly not be able to get up and go and run a marathon. And I think the same thing is true with sustainability. It's you can't wake up in the morning and decide it's sustainability time. You actually have to have something that you can sustain. This little picture on the left of what we consider at IHI to be the improvement book, the improvement guide by Associates in Process Improvement. I heartily recommend it. No financial connection. It's just a practical, it's not dry, lots of practical examples, and really moves through the very practical steps of improvement. So if we want to create sustainability of an improvement, we have to have really thoroughly tested it first. Why? So that the change idea, no matter how brilliant and wonderful the change idea is, it has to be adapted to the environment that it's being used in. It has to gain staff buy-in. It has to be worked into workflows. We have to figure out if there is different equipment that is needed, different processes. So even the best change idea can fail miserably if it is not thoroughly tested in the environment where it's going to be used. And then once we've thoroughly tested, we have to make sure that we are thoroughly implementing. And the distinction there is that we've got a change idea, it's leading to improvement, it's working in multiple conditions, and now we need to implement it. We need to change the policies, the procedures, the training. We need to remove the old way of doing it. So you cannot, very genuinely by definition, you cannot get to sustainability until you've thoroughly tested and thoroughly implemented. Otherwise, you see this little red arrow over to the side. It's kind of like that little triangular wedge that postal workers have to put under the wheel of the postal trucks. Otherwise, the wheel's just going to roll straight back down. So it is thorough testing and thorough implementing that allows us to move towards sustainability. This is some work that has grown out of IHI over the last 5 years. I have found it really helpful as a mnemonic, MOCA, measurement, ownership, communication and training, hardwiring and standardization, and the assessment of the workload. I'm not going to go into great detail here due to time, but you got to keep track of whether or not the change is being sustained. You got to measure that. Someone's got to own the process. You need a good communication plan. You got to hardwire it into the system, and you got to keep track of what it's doing to the workload. So there's more information about this on the IHI website, but I'm finding that MOCA acronym to be really helpful. And then the last thing that's been on my mind lately, of course, is regarding equity. There is no quality without equity. And this cartoon, I think, for me, really speaks to the importance of having context experts in all the work that we do, people with lived and living experience, nothing about me without me. If we are going to provide equitable care for every patient every time, we have to do that arm in arm with the people who are on the receiving end of the systems that we have in healthcare. So this little cartoon by Nathan Pyle, one of my favorites, he does the Stranger Planet, And the eagles just cannot begin to understand how the mouse finds the owl so bothersome. And this is, I think, really speaks to why having people with context expertise at the table is absolutely essential. So there is no quality without equity. And lastly, I will just say a big, big hearty congratulations to all of you, to everyone, and especially to those who received awards today. Lisa had shared with me the next generation theme at your meeting today, and the work you're doing is quite literally about the next generation. The care that you provide for birthing people and those who love them is about helping the next generation come into our society safely. So I'm incredibly grateful to you. And I think knowing who's in the room today, the incredible importance of interdisciplinary work, of teamwork, of understanding that we share the obligation in how we care for birthing people and their babies across cardiology, emergency medicine, family medicine, pediatrics, OBGYN. We are absolutely all in this together, very genuinely. So thank you, thank you, thank you for doing the work that you're doing. Again, I'm sorry I couldn't be there with you today, but I'm very grateful to get to say hello. Take care. Thank you.